Hi, my name is Caitlin Walker, and this is going to be my wound care video. So to begin, I'm going to wash my hands, enter the patient's room, provide them privacy, introduce myself to the patient, get their name, date of birth, check the wristband, 2 patient identifiers. I'm going to explain the procedure to them and ask if it's okay, and they said yes, so we're gonna go ahead and get started. I already washed my hands, so I'm gonna put on clean gloves. Okay, and once gloves are on, I'm going to open. Okay, and once that's opened, I'm going to go ahead and take my red bag carefully and go ahead and open this up. Then I'm going to fold the edges so it's easier to throw things in. Okay, once I've done that, ask the patient if it's okay if I place it here. He said yes. Go ahead and set that up. Okay. And I'm gonna I just realized this, I'm gonna go ahead and raise the patient's bed. I should have done that before I started, so that was my mistake. But I'm gonna go ahead and do that now. All right, there we go, we're all the way up. And I'm gonna go ahead and put this rail down. Okay, back to what we were doing. So I put the trash bag down. I'm gonna go ahead and remove this away from the patient. Assess it, make sure everything's okay. If he wants to look at it, he can. But once I have that, I'm gonna carefully drop it in there and then take off dirty gloves. There we go. I'm gonna wash my hands again and then grab, I need to try not to go over this. Grab these, okay. Then I'm going to stay within the 1-inch margins of these gloves. Carefully open them. Grab this one. Sorry, I'm struggling. There we go. Next, I'm gonna grab underneath, like so. And then, there we go. Okay, now that these are, I'm gonna keep them above my waist to stay sterile. To begin, I'm gonna go ahead and arrange my supplies carefully. Okay, and then I'm gonna take a clean Q-tip and I'm gonna start by going down the middle, this wound, carefully, dropping the Q-tip. For the sake of this video, I'm gonna just pretend and use the same one. I'm gonna go around, go down, back around, drop it in, and I'm gonna go down this way, drop it in, go around, down, and then that was 5 times total. Discard the Q-tip, get a new one. Then we're gonna start with the stab wound. I'm gonna go away from that clean incision. 1, 2, 3, 4, 5. Okay, now that's all clean. Gonna go ahead and grab some gauze very carefully. And I'm gonna make sure the gauze does not touch the other wound, and I'm going to gauze them separately, like so. I need to actually, I forgot, cover the stab wound first. That was my bad, my mistake. So I'm gonna cover that one first. And then again, keeping it separate, like so. Okay. gonna go ahead and put the big one on carefully. Alrighty, and now that that is on, I'm gonna go ahead and take my tape. I'm going to window pane it and being as careful as I can not to touch the patient's skin. Alrighty, now that I've window paned the tape, I'm gonna go ahead and put my initials, the time, and the date on there. And then next I'm going to, now that that's all done, I'm gonna take off my sterile gloves, throw them away, gather my supplies, throw anything that needs to be thrown away, get rid of the red bag, and then wash my hands before I leave, and then he's all done. So again, my name is Caitlin Walker, and that was my wound care video.